Afternoon, everyone. Just give it a few more seconds. Hopefully, a few more people will join us. Okay, well, I think I'll make a start, and hopefully those who are still hoping to join will at some point. So thank you all. Thanks for attending as always. Good opportunity for me to be able to pass on any updates, and of course, more important is opportunity for people to ask questions. As always, you can either do that, of course, via the chat, or if you're feeling brave enough, please do pop your hand up. Always good to hear from people. Before I start, just to say we've been reviewing question time and the approach, and being able to switch to virtual means has been it's been a lifesaver really throughout COVID, and not just in relation to COVID. I think it's still a tool that will remain within our tools in how we do our jobs, certainly for the future. But we've just been reviewing it, and although as much as virtual is great, there's nothing like as well having the opportunity to meet with people and speak to people face to face. So we're proposing, we're going to move to this forum to a monthly forum. But again, we know that we still have people that are working from home, so we will be doing it from a hybrid approach. So therefore, me in the room, but also with the technology to be able to both launch myself into people's studies and living rooms at home, but also with the opportunity for people as well to be able to ask questions. So we're just working through the practicalities of that at the moment. So but hopefully to move into that from September onwards. As I say, it's always good to be able to see people face to face as well. And we've started to move things like our trust induction, etc., back to face, and I've seen the benefits of being able to do that. So that was just the first thing, just to update on. I'll take you through a couple of other areas first. From a COVID perspective, always useful really to give updates. Always hopeful not to be able to really talk about it, but it is more positive. We have started to see prevalence drop, so certainly going in the right direction, and that's both from a hospital admissions perspective, but also staff absence as well. Although I say hospital admissions have dropped, they're still fairly high. Certainly Shrewsbury and Telford around 80. But they were over 130 again during this wave. I'm pleased to say sickness absence from a staff perspective, the report I saw yesterday, there's always a bit of a caveat with a Monday report, but it was showing about 0.6% staff absence in relation to COVID. So much lower. We were at about 2% a few weeks ago. So definitely an improving picture. That's not to say it's still having impact on patient cancellations at times, etc., and individual certain areas from a staffing perspective, as well as outbreaks. So there is still that impact there, but certainly far more manageable. The other thing just to update, and there may or may not be changes, but SARA and the IPC team, as they've committed to do so, to keep face mask wearing under constant review, and people will be aware we stepped it down, brought it back in because it was the right thing to do, as prevalence started to increase across the community. We're not saying there will be any changes, but they're certainly sitting down to review face mask wearing. Certainly on corridors was one area of focus today. So as always, we'll update, and we'll only take action if we feel it's the right thing to do. And as we've said, continue to be agile and move with what what the requirements are, depending on prevalence, etc. So that was it from a COVID perspective. Just in relation to infection prevention and control, again, huge thank you for everyone's continued efforts in relation to the improvements that as an organisation we were required to make, and also in relation to the large improvement plan that we're working through. So again, really good to see that them improvements continue. A couple of updates. We continue to have regular meetings and conversations with our regulators, which again are being very positive. A lot of acknowledgement of the improvements as an organisation that we've made. A couple of weeks ago, I think it was probably the last time we had question time, but certainly in that week, Kirsty Morgan from NHS England visited theatres. I think it was HDU and Bashchurch unit. We're still awaiting the formal report from that review, but feedback on the day again was positive. There were some findings, but nothing significant to cause additional concern or to almost put us off track in relation to the improvements that we've been working to do. As I will always say, there is still more to do. As I've said, it's a large action plan, and an action plan is one thing. It's how you ensure you sustain and embed the improvements. So that's where we've still got a bit more work to do to sustain the positive changes. Just off the back of that, one piece of work that people will be aware of was the new uniform and dress code policy, well, the revised uniform and dress code policy that we launched a few weeks ago. I hope people will have seen in comms yesterday, we're committed to doing an F&Q document to help. There was a lot of questions coming, great questions and the right questions, but to be able to help and support individuals and managers, we've pulled that document together, which is available on Percy. And again, as we've said, if there are other questions that people that we haven't answered within that document, again, we can include. If one person's thinking of something, I'm sure other people are. So if we can share some of that across the trust, I think that's really helpful. So that was it from IPC. CQC. Some people will be aware, and I think again this has gone out in our trust communications, but today and tomorrow we welcome the CQC on site with us. This is to support, and it was a conversation that we had with the CQC pre-COVID. So this is taking us back a fair 2.5 years ago, I think, when we first started conversations with them. But we're supporting them in a pilot approach to how they will inspect medicines for the future. So picked us as a pilot site to support that piece of work. So they'll be on site today and tomorrow. They'll be around and about in the organisation. And thank you to Maurice and the pharmacy team. I know have put a lot of work into the planning for this inspection and review. It's not a formal inspection, so we won't be rated on it as part of our CQC ratings, but we will receive feedback that won't be published, so it won't be in the public domain. And of course, if they find anything of concern, the expectations is that we would act on that as we would with any other concern that was raised in the organisation. So I'm sure, as I say, they're out and about today and tomorrow, so I'm sure some of you will have some conversations with them at some point. Then the last thing from myself, and some people will be aware, we've been looking at the senior level structure within the organisation. So over the last couple of months, looking at how we strengthen it from the structure that was put in place right at the very beginning of the pandemic, right early part of 2020. Again, I chose to do this because it's right to review structures that you've got within the organisation, but also from feedback that I'd received via the staff survey. Results was one area, and again some other feedback that I'd obtained through different sources. So over the last couple of months, lots of conversations with those people that it will affect, a lot of engagement. So we're all thereabouts to be able to launch that new structure. We'll put some comms out. As I say, it's senior level. So if it affects you in any way, conversations would have taken place. So I don't want people to be concerned that there's anything that involves them that they're not cited on. So as I say, we'll get the trust comms out off the back of that when we launch that. But again, I think it's positive. It will hopefully help us address some of the challenges we've got from an operational perspective that COVID and the pandemic has put upon us. So I think it will support with some of that. It's very much it will improve from a clinically led perspective. So that was something that I didn't want to lose off the structure that we'd got in place. So it should strengthen that. So as I say, there'll be more to come in relation to that. I think I'll pause there just to see if there's any questions, anything coming in through the chat, Chris.
It's quiet, Stacey, that I can see. I've got a couple of things to bring up, but I'll just pause and see if anybody else does first. This is your chance, people. If you've got questions for Stacey, you can stick your hand up now and ask her directly, or you can stick it in the chat. And there we go. Louis McDonald, well done. Always nice to see someone being brave. So Louis, come on in and ask your question.
He was there. Unmute button first, sorry. It was just around the pay deal for the 22-23 pay deal. So I saw something in the press a couple of weeks ago to say that it's kind of been agreed, or what NHS staff will get. But do we know how that's going to work here?
Not yet, Louis. I think that's been worked through, and again, not to pass the buck, unfortunately, we don't get a say in it as individual organisations. The pay deal is the pay deal.
Yeah.
But I know the people team are currently working through that to be able to communicate out really what that means, because it's very different depending on, as you've probably looked yourself, and certainly what I've been able to grasp from the documents that I've read. It varies from band to band what that pay award is. So I know that's currently being worked through at the moment. So we'll make sure, whether it's I take something to one of the managers' briefings or we do something a bit more in these sorts of forums. I think if we bring the people team in to support that, I think that might be a good thing, Louis, because I'm sure a lot of people will have questions or some concerns off the back of it.
Yeah. Okay. Thank you.
I think it's worth noting, isn't it, Stacey, that whenever it is finally sorted and we get it, it is backdated to the 1st of April. So even if it takes a month or two, you will get the money back to that date.
Yeah, it's always backdated, but yeah, it wasn't as straightforward as I think as what it was led to believe it was, as in a pay award for everybody. I think it does vary depending on bands.
Yeah, it does. Yeah.
Anybody else with any further questions?
I do have another one.
Go ahead, Louis. Take the stage.
Just around the vaccination centre, and are there? I suppose it's more of an ICS kind of. It's led by the ICS, isn't it? But is there more of a plan to do vaccinations in a primary care setting? As obviously they're needed, or less and less, and I suppose the the footfall going through our vaccination centre and SAT's vaccination centre is dramatically reduced these days. Is there more of a plan to close the vaccination centres on the hospital sites and pick it up as part of flu vaccinations, or within the primary care setting? I don't know.
Yeah, it's good question, Lou, and it's something that we've started some conversations. And you're right, it's Stropcom that are the lead sort of provider for the service. It was SATH, it got transferred over to Shropshire Community, and I think for the right reason of surely we should start, as this becomes almost business as usual, you know, vaccination within the community as opposed to utilising acute hospital sites. So at the moment we've signed up for the space until the end of this financial year, but then conversations have already started around GP primary care. I think having the vaccination centre will help us. Certainly, as people will be aware, there's a 4th booster programme for NHS and care staff as part of flu vaccination, and we're fast approaching that season already. So I think having that facility on site will support the uptake as we saw last year. But yeah, conversations have already started, Lou, around the future of the, you know, and not just our site, SATH site, but again just sites in general. And you know, surely primary care, community pharmacists, them sorts of areas should be where the future lies, really.
Yeah, I just think that obviously space is at a premium everywhere, isn't it now, more so than ever? So
yeah.
Okay, thank you.
Anyone else for any more before I've got a couple, Stacey, if that's all right. Just
yeah, that's fine, Chris.
Covering. Right, okay, so in the news today, Stacey, there's stuff about elective care and the progress the NHS is making. There's quite a positive story on the BBC website suggesting that the NHS in general has eliminated 2-year waiters. I mean, can you maybe update the room on how we're doing as an organisation and the progress we're making on those things?
Yeah, thanks, Chris. And yeah, it is a good news story of the focus that all NHS providers have had on this, including us. As people will be, we have a plan, we have a trajectory. How they're reporting is different, and that's not to say there's anything wrong with how they're reporting it, but they're reporting 0 being from a capacity perspective, as opposed to complexity. So we still have 104-week waiters, but their class, due to their complexity and what provision is available to support that, is how they're being counted or reported slightly differently. There's 3 categories: complexity, capacity and patient choice. And again, there are still patients that have chosen not to have their surgery at the moment that have been waiting over 2 years. So you've got that cohort, the complexity cohort, but this one is very much around capacity. Where that's helped is independent sector. Again, people internally will be aware we have conversations with other providers. At the moment, Royal Orthopaedic, we've had conversations with Kettering, different trusts to see could they support certainly some of our certainly the complex spinal work. So it is a good news story. The focus is still very much on it. So I received a letter yesterday, a very nice letter acknowledging the work, and to pass on my thanks to the teams at the hospital around the work that's been done in relation to long waits. But you know, soon went on to still work to be done, 78 weeks. So patients that have been waiting 78 weeks, 52 weeks. So it is positive. We've hit our trajectory for the last couple of months. The focus is on our long waits, as well as all our other performance metrics, which are just as important. You take your eye off something else and you've got a problem later on down the line. So yeah, but it was good, I suppose, Chris. I heard a brief mention of it on the radio, and it was positive. The NHS was recognised in a positive way for the work that had been done. So that was, at the moment, it feels like we're not hearing that much positivity. So that was good. That was good to hear.
The other thing I just thought was worth a mention today, Stacey, you've previously spoken to people about the NHS High Potential Scheme and encouraging our staff to come forward for that. The deadline for applications for that is Sunday this week. So I just wondered if you wanted to take the chance to talk about it one more time and encourage people to think about that.
Yeah, if I get any opportunities to plug it. So yeah, thanks, Chris. And yeah, I'd forgotten actually it is, isn't it? It's the end of this week. I've mentioned previously, I was really pleased to put myself forward as exec sponsor for our ICS, for our system around this high potential scheme. And it is very much around recognising talent within organisations and our local authorities, and being able to support people to be in a position for promotional prospects, further development, etc. So it's not just based on previous experience or band, which is good. That there needs to be able to put yourself forward. You need to be at a certain level within an organisation, but it very much focuses on talent as opposed to where you currently are in your career. I met with cohort 1 from Staffordshire and Stoke ICS. There's about 20 participants that went through the first cohort. All of them couldn't have spoken more highly around their experiences, how it's built their confidence, their leadership skills. And I think, I don't want to quote a number, but certainly many of them have gone on to promotional prospects, so deputy director level. So it really does evaluate extremely well. So please, I've already had, and it was great actually, a couple of staff approached me individually that I've met with. So, you know, please do. If you've had a look at the application, or if you've started it, I get to hear, I don't get not names, but I get to hear how many people have started the application. So a lot of people, certainly my update last week, had started but hadn't completed it. So if it's something you've been considering, get your application form in. It's a really good opportunity. Thanks, Chris. Thanks for the reminder.
I was going to say, sort of following on a little bit from that, it's one of set 3 or 4, isn't it, leadership and development type programs at the minute that the system is offering. And I guess this is one of those examples of where system working can really benefit us and our staff, because these are maybe programs that on our own we wouldn't have been able to offer, and opportunities we wouldn't have been able to give to develop people. And I guess we would, I hope I'm right, you'd encourage people to be looking at all of these opportunities when we're pushing them.
Yeah, it's a really good point, Chris. It's an area, as working as an ICS, we can pull things together. Whereas for us as an organisation, to put on so many different development opportunities would be incredibly challenging. But where we can pull on some of the resource as well from the system, and again some of the well-being elements as well, Chris, we've found, haven't we, through COVID, pulling together as an ICS actually, yeah, certainly I believe we can get more out of it. And I think when I think of leadership and development as well, gives you further opportunities for networking, meeting different people within the system, different viewpoints on things. So not only does it bring more development opportunities to our staff, I think gives also our staff a different experience, whereby if you just did an internal leadership development program with our own staff. So some people may disagree with that because it's more comfortable with people that we know, but if you want to try and stretch yourself, I think, and challenge yourself, sometimes doing it with people that you're not that familiar with, I think can be helpful. But yeah, really good point, Chris. There are many benefits, I think, working across systems.
Those were the things I wanted to bring up. I'm sure everyone's heard enough of my voice now, so we'll just give another opportunity for anyone else if they've got any more questions. Otherwise, Stacey, I'll come back to you because we're coming close to the half hour now. So
brilliant. Thank you. Thanks, Chris. And yeah, get out on the path. I certainly did yesterday. I didn't see many people, but it was very hot. It was late yesterday afternoon when I managed to do a couple of laps of the path, and it was, yeah, I was very lonely yesterday. So hopefully may bump into a couple more people later on today. But yeah, I think we'll close it there. So thanks all. Thanks for contributions. Hopefully well received around the hybrid approach. You know, great to be able to do it face to face, but also want to recognise that we have staff working incredibly hard still at home. So yeah, hopefully this will be an approach that suits all. So as always, thank you. You know, lots of great work happening, lots of improvements, still lots of challenges, and I think that's how it is. Certainly after COVID and trying to recover. But yeah, really grateful and big thanks to everybody. Take care all. Thank you.
Cheers. Thank you.